Namaste friends. Greetings on World Hypertension Day. Today is 17th of May 2020 and is celebrated world over as World Hypertension Day. The aim is to increase the awareness of hypertension and get people to get tested and get treated for hypertension so that we can avoid the ill effects of this silent killer. My name is Dr. Rammohan Bhat. I'm a nephrologist at Narayana Health, and today I'm going to talk to three other eminent doctors, specialists from Narayana Health, Bangalore, who are going to talk to us about hypertension, how we can control it, and certain aspects related to the current pandemic, which is causing a bit of concern in our hypertensive patients. Due to the prevailing coronavirus pandemic, we've not been able to do much in terms of physical activity to increase awareness, but we want to reach out to you through the Facebook Live today to educate you about hypertension and why it is important to treat it. First of all, I've got Dr. Srikanth KV. He's a senior cardiologist at Narayana Health. He's got special interest in heart failure and he's a key member of the heart transplant program at Narayana Health.
Hello.
Welcome, Dr. Srikanth.
Hello. Hello, everybody.
Because of the coronavirus situation, we are maintaining social distancing. The other two consultants whom I'm going to invite later on are waiting outside the room, and I'll call them one after the other so that we don't crowd this area. About 1.2 billion people, I'm going to wear my mask as well so that we don't create any droplets as we speak. So about 1.2 billion people have been diagnosed with hypertension as per WHO data. And 75% of them are in low and middle income countries. It seems 20% of death worldwide can be directly attributed to hypertension related problems in various organs. In India, it is believed that 20 to 30% of the general population, be it in rural area or urban area, young and old together, 20 to 30% of us have hypertension, but not many of us have been diagnosed with it. World over, in those who've been diagnosed, only 1/5 have got good control. So it's only a small proportion of these 1.2 billion who actually have got good control. Half of them probably don't even know that they have got it. And even those who know, only 1/5 are able to control it very well and derive the benefits of good control. Today, the first question I've got for Dr. Srikanth is to talk to us about how would you define hypertension, when would you treat, and is the target for treatment different in elderly and in special cases like diabetes?
Hypertension is the pressure exerted by the circulating blood volume against the arteries. So we cannot find out with any symptoms. So the only way we can detect a hypertension or person is suffering from hypertension is to measure it. So unless we measure, we cannot find out what a person's blood pressure is. And so each person can have a blood pressure which is at varying levels. So we define hypertension as any blood pressures above 140 and 90. So there are various organizations which define in different ways, like America have their own guidelines, Europe has their own guidelines, and world again have different guidelines. So whenever we see the blood pressures are more than 140 and 90 and consistently above that, and then we start treating those patients. As you rightly pointed out, there are certain subsets of patients like who have diabetes or who have heart disease or who have heart failure or kidney disease. There we use a different threshold. It may not necessarily be 140 by 90. 140 by 90 is for somebody who doesn't have any other comorbidities like what I mentioned. And the point is, although we define blood pressure of 140 and 90 above is abnormal, it doesn't mean that somebody having a BP of above 130 and 80 is having a normal blood pressure. He's also at higher risk. Why are we concerned? Because if you don't keep their blood pressure lower, they can have on a long-term problems. So the thresholds, again, how much to bring it down depends on what kind of diseases they suffer from.
Yeah. So I must remind you that whatever Dr. Srikanth said would hold good for the adult population, anybody older than 18 years of age. Kids, it's a different ball game altogether. We define blood pressure as high blood pressure based on their age and their weight, etc. There's an algorithm for that. So we go by that. So kids usually have a lower blood pressure. So we have got different targets for them. This would hold good for the elderly, so for the adult population, 18 years and above. My next question would be to Dr. Murali Mohan. I'll kindly ask you to step out of the room, and I'll call you again for the next question. Thank you very much. So I would like to invite Dr. Murali Mohan to come. So please. Dr. Murali Mohan is our chief internist and head of respiratory medicine at Narayana Health City. Thank you for taking time out, sir, and coming and taking part in the Facebook Live. My question to you would be, one of the major problems world over, and especially in India, is about increasing the awareness of blood pressure. People still don't know much about the concept of hypertension, high blood pressure, and if they're not aware, they tend to ignore the fact that they have got high blood pressure even when they're diagnosed. And they will not come forwards to get diagnosed. As Dr. Srikanth said, unless we check, we will not know, because most of the times it's asymptomatic. How do you think we can increase the awareness in our population?
So I think the first and most important thing is to emphasize to people that hypertension is a disease. It's also known as high blood pressure. Unfortunately, many people think that hypertension means it's mental anxiety, and as your tension increases, it shows up as anger and bursts of rage out, So that's not what hypertension is. So I think that's the first thing that doctors need to do, to emphasize that it's a measurable disease. And the measurement is very, very simple, that you use a BP apparatus to measure hypertension. And this has to be done periodically in especially people past the age of 40 or 45. And as it produces no symptoms, it's very important that we actually have to measure it. And there's no other way of finding out. And there are well-defined criteria to measure it, Srikanth, therefore, to when we call it hypertension. So since we can have a number to look at, we need to look at those numbers and do it periodically.
Thank you very much, sir. I've got more questions for you, but unfortunately, I'll have to ask you to leave so that I can invite the next expert on the panel here, Dr. Krishna Kishore. He is a senior consultant nephrologist at Narayana Health City. Thank you, Dr. Kishore, for coming. My question to you would be, so one challenge is to increase the awareness in our public. The next challenge is to get them to accept the condition and convince them that they need to take appropriate measures to control blood pressure. It is not only medicines. We were the last people to give medicines, but things like diet, exercise, weight loss, everything, it has to be done, and there's a lot of involvement from the patient. How do we convince them that this is real? They have to take it seriously and get it under control.
Thank you, Ram, for having me here. As you rightly said, that's a difficult part of it. In the initial sentence that you pronounced, you said that 20% of the people only have control of their hypertension and rest 80% are not having it. That itself goes on to show that the most difficult part is to convince or to make them take the medications. So what are the various ways that we can have to make them be compliant with the medications? The first one is, this health education has to start very early. Maybe in the first meeting, maybe in the school for children probably. So the two most common diseases that is paralyzing the world right now is diabetes and hypertension. So of these, hypertension is more prevalent and it's increasing day by day. So the first thing I would say is appropriate health education start very early. So it's a preventable disease if the measures are taken much early. Number two, so the other thing that they have is the people are so much immersed in their work they forget to take their medications. So we can put in a way so that we can have some drug combinations where we can have 2 or 3 drugs together. So we can give us a one pill, so reduce the pill burden. So the other way we can make them be compliant with the medications. And the third would be to have reminders. These reminders could be in many ways. So it can be, they can set a reminder in their own gadget like phones, or they can have a companion or somebody at home who can remind them regularly to take their medications. And most importantly, we must emphasize that they check their blood pressures regularly. So that in itself will tell them that the blood pressures are not controlled, so they have to be taking the medicines regularly. And what I would suggest other thing is to have a group meeting where the patients together, they can have a meeting amongst themselves, especially those people who are affected by hypertensive complications. As we know, hypertension is a disease that can affect various systems, starting from the brain to the heart to the kidneys, various blood vessels. So we can have various people affected by this hypertension and its complications, and so that they can explain to the patient, to the other person who is not affected by the complications, to be compliant with the medications, so that would help them to prevent these complications in the future. So these are some of the ways I would say to keep them compliant and also to educate them to be compliant to prevent various complications that might ensue if uncontrolled hypertension persists.
Yeah. So you're saying you need a stick and a carrot to get people. Yeah. So I would like to add that we need huge cooperation from the government as well. Because unless government spends money in advertising the importance of blood pressure and sugar control, it is going to be very difficult for the healthcare industry or the doctors or the paramedics to try and convince people that this is real problem. This is a real problem, and it is something that you have to treat. So I would say that as a healthcare community, we have to pressurize the government to spend more, in advertising about control of blood sugar and blood pressure.
I completely agree with that. So there is a very, very famous study in nephrology that is done by eminent nephrologist called Murali. So what he has done is he's taken 2 villages. In one village, he's given the cheapest drug called Reserpine, and the other village was not treated. So he was monitoring that, and it was proven after 5 years interval, the number of complications in people who are treated with the drug is much lower as compared to the other group, obviously. So the point here I'm trying to make is it's not the medicine, it's the blood pressure control. It's not about which medicine one is taking, it's the blood pressure control. Yes, government can clearly pitch in here because the medicines are to be given for hypertension are not very expensive, so that can be provided on a mass scale and with a checkup in addition. So definitely it's going to do wonders for the people with hypertension if government takes an initiative and goes along with the medical practitioners to help those people in need.
Yeah, thank you so much. I've got more questions for you, but I'll ask you to excuse yourself, and I would like to invite Dr. Srikanth once again onto the hot chair. So the question to you, Dr. Srikanth, is yes, medicines is fine, but I always felt that other than medicines, exercise and diet and weight loss, they have to be the foundation. Exactly. And what do you feel? How important is it as vis-a-vis medicines? Is it going to be more important, as important, less important? What is your take on it?
No, medicines are kind of the basement. Okay, I mean, any person who has a hypertension, he has to. I'm sorry, I went the other way around. Lifestyle changes are the basement. So we have to have lifestyle changes. What you mentioned, like being active, maintaining their weight, taking care of their diet, physical activity. These are very important. And on that we add upon the medications. The medicines will not work if you don't maintain your lifestyle. Mm-hmm. The recommended ones are like being physically active, having a healthy diet, not using tobacco, and alcohol to be either stopped or in very moderation, don't start, and weight loss. So all these are very essential, and all of them do contribute significant amount of BP reduction. So if we don't, if we are not following them and you take any, many times the medicine may not work, and the reason could be that they are not following their lifestyle. So it's very important for all hypertensive to maintain their lifestyle, healthy lifestyle, and also who are in the borderline. Say somebody is having blood pressures of 130 and 80 and above, but less than 140 and 90, they also have to follow the lifestyle. Otherwise, this hypertension incidence increases as we become older. So if somebody starts their lifestyle changes, it's not probably somebody, it must be everybody. As you were telling, if the government starts to educate people about leading a healthy life, Fit India movement is one of it. So we can reduce the BP of the population as a whole.
Yeah. So I would like to spend a minute more on this because I feel this is the most important part. So with regards to diet, what are the dietary changes you would advise?
Dietary changes like salt restriction, having a diet which is rich in fresh fruits and fresh vegetables, then avoiding use the whole grains. Try to avoid the polished grains. No sugar sweetened beverages. Sugar sweetened beverages have to be avoided, and all these will also contribute to reduction in sugars and cholesterol, which will also help the person on a long way. Avoiding oily food. So whatever diet you are taking, it should help you regenerate yourself and also avoid increasing the weight. So you have to watch on your calories. If you are overweight, try to reduce it. That's how we do.
How much salt would an average Indian diet have usually?
So there are various recommendations like 1.5 grams per day and other things.
Yeah.
So
would cutting down the salt by about 60 to 70% would that be very helpful?
Definitely helpful.
Yeah.
What I tell is the food which contain high amount of salt, like the fried items or the pickles and all, they are the papads. They are the ones which have to be avoided. And what you use for routine cooking, if it is on the lower side, that will be great.
And what kind of exercise would you recommend?
Exercises like at least 30 minutes a day. Any kind of free exercises like walking, jogging, swimming, or even yoga, all those will help. And keeping your mind clear, calm by doing relaxation things like pranayama or dhyana, they will also help. And exercises should be something which they can consistently do. It's not that you just listen to somebody and you start doing it and after some time you stop. So whatever you choose, it should help it should be part of your lifestyle and you have to continue it throughout and lifelong. That would be the
excellent.
I would suggest.
Thank you so much. I've got more questions, but I'll call you back again. I would like to invite Dr. Mohan again. So, welcome back. So, Dr. Srikanth did mention a bit in the passing about yoga, meditation. What I would like to ask you is how important, how useful these things will be, yoga, meditation, and also I would like you to talk about alternative medicines like Ayurveda, Unani, Siddha, naturopathy. How useful can these be? Are they very reliable? And how do we make sure that if people take up to those things, we don't lose track of them, and how can we make sure that their blood pressure is under control, and at what level would you say, so there are three questions here. So at what level would you say that is not sufficient, and then you might have to take some conventional medicines as well?
So I think the first step, as Dr. Srikanth was saying, is always the non-pharmacological methods. Okay? So we start without medicines, and this depends on the level of blood pressure that you find initially in the person. And any form of relaxation therapy, which he referred to, pranayama being one of them, meditation, all these certainly help. So that would be the first step. But very often that's not enough. Regarding the other schools of medicine, I really would not be able to comment because I'm no expert in Ayurveda or Unani. Just remind you that one of the first drugs that was used for hypertension, recipe, came from an Ayurvedic medicine. It's called Sarpaganda, and Sarpasil was a trade name. That came really from Ayurveda. But the difference really is that in modern medicine, we have purified these, we've isolated the important element, we give you exact doses, so the dosage is very, very important. It can't vary from day to day as a crude preparation would have. And that's the difference really, I think, between a very specific medicine used in a specific way. We understand how it works, we understand how you have to monitor its use, and we have definite targets. Now the target would depend really on the condition and the age of the person. So we might set variable targets depending on whether the person has high BP alone or has high BP with another problem like diabetes. But the only way to know that you succeeded in reaching where you have to be is by measuring the blood pressure. We also obviously look at other factors. What effect is this blood pressure having on the person? So we talk about what is called target organs. So we look at the heart, we look at the brain, we look at the kidneys, and all these will tell us is the BP and the eyes, and we look at these and we decide, is the BP having an effect on the rest of the body? How much more aggressive should we be in its management? Is a single drug enough, or do we need to add multiple drugs? I can tell you from personal experience that when I was first diagnosed to have high blood pressure, it was pretty high. I spent the whole day meditating, relaxing, and my BP came down to normal and remained normal for almost a year. And then, of course, it went up again. So it's not like I didn't have hypertension, but I was able to bring it down with a combination of diet and meditation and exercise. And I think those are really the key. And in the early stages, we catch it and we put a person on these treatments. We can often succeed in keeping it under control, either permanently or for some time.
Excellent. So, the proof of the pudding is, whether the blood pressure is under control or not, no matter what, you're resorting to control, to achieve blood pressure control, we have to keep monitoring the blood pressure. And then if whatever you're doing, be it yoga, meditation, etc., they are very useful. Yoga, meditation, exercise. We don't know about the alternative medicines because we've not studied about it. But if somebody uses them, we would recommend check the blood pressure regularly. If your blood pressure is not under control, then you have to change track.
Absolutely.
Yeah.
And we must remember that these are called complementary medicines, okay, or complementary therapies. So you may need to add something onto them to achieve your target. And the goal is reach the target.
Yeah. Thank you very much, sir. Next question would be for Dr. Kishore. Kishore, being a nephrologist, I want to ask something renal for him. So, what are the different organs that high blood pressure can target, can affect? And in specific to kidneys, how different would be the target for blood pressure in people having protein leak or proteinuria and deranged renal function or CKD?
As Dr. Mohan has mentioned, this hypertension is a systemic disease. It's not a local disease, it's a systemic disease. So it affects various organs in the body. So we see the most important organs that it affects are the brain, the eyes, the heart, the kidneys, apart from the blood vessels from where it originates. So let's suppose anybody is having hypertension alone, the targets are slightly higher, but as compared to people who are having more than hypertension. Especially the kidney disease. Hypertension per se can cause the kidney disease, and the kidney disease can cause hypertension. It is possible both ways. So in people who are having hypertension and kidney disease, the targets are much less. The targets to attain the blood pressure, to have the blood pressure under control is much less as compared to having hypertension alone. For example, a person with hypertension and proteinuria, we want the targets to be dropped down from 140 to as low as 130 and the diastolic from 90 to 80. So whether these are associations that are found in large studies that lowering the blood pressure can reduce the progression of the disease. So when we tell about progression of the disease, it's that the ill effects of the hypertension which are going to have on these organs can be retarded to an extent. So that's about the kidney disease with proteinuria. Let's suppose somebody is having diabetes and hypertension. Even in this case, the control of hypertension becomes much more important than the diabetes control. I don't mean that we do not have the diabetes under control. It's important both of them under control. If you ask me which one is more important, that's where we say that probably blood pressure control is much more important. Having said these targets, yes, it's difficult to have these targets attained all the time, but we say majority of the times. Most of the readings should be under control, that's what we would say. So to know that, it's again essential that they record the blood pressures regularly and maintain them within the target range.
Thank you very much, Kishore. My next question would be to Dr. Srikanth.
Yeah.
Srikanth, welcome again. So, what are the effects of high blood pressure, hypertension on cardiovascular disease, and how effective would controlling blood pressure be in terms of preventing or reducing cardiovascular morbidity and mortality?
Yeah, I think if we consider which are the reasons why people have heart problems, probably tobacco and hypertension compete with one another. So it's very important that it is one of the reasons why people develop heart problems. In the heart, it can cause thickening of the heart, it can cause impairment in relaxation, it can cause heart failures, it can lead to the cholesterol deposition, it will encourage cholesterol deposition, predispose to heart attacks, and as Dr. Kishore was mentioning, it can also cause atherosclerosis. I mean, the large arteries can become larger, and they can enlarge, and they can cause a rupture of the arteries. And anyway, other organs are also there. So, hypertension is one of the leading causes of heart diseases, and controlling it is very essential.
And stroke would also come in the same spectrum of.
If we see the overall person as a whole, if we can implement the lifestyle changes, they all improve many organs or a patient's health as a whole. If you control the blood pressure, he'll be more healthier. And not only we are controlling the blood pressure, we are reducing his risk of developing heart problems, kidney problems, stroke, and those kind of things. So it's more of a holistically, the person is becoming healthier, and if there is some event which were to happen, if his blood pressure were not controlled, with control it can either be postponed or prevented. So that's how it's so important.
Yeah, and then over the last 50 years or so, there might have been hundreds of studies done in looking at control of blood pressure and the effect on cardiovascular disease. Are they quite convincing? And how many numbers? When you talk about numbers, I know cardiology, you talk about tens of thousands of patients. So are they very convincing?
Very convincing. There is no doubt that. It's only that which one is how much. We know it very well that hypertension leads to the problem. And say in various studies it's attributable risk of around 20 to 30%. So and it's no study will ever be complete without considering hypertension as
so it is quite obvious that it would be foolish to ignore hypertension.
Definitely. And the numbers probably are not in terms of thousands, it will be in terms of lakhs of patients having studied over a long period of time. We know that
very, very robust evidence. Yeah, perfect. Thank you very much. My next question would be to Dr. Murali Mohan. So welcome back. There is a very close association between hypertension and sleep disorders. I would like you to educate us about all those things.
So there's a very close connection between sleep disorders, as you said, and hypertension. And this is in multiple areas. So one of them, of course, is when a person doesn't sleep, the blood pressure tends to go up the next day. But it's the quality of sleep that really matters. And the quality of sleep often gets upset in this condition called obstructive sleep apnea, which has the best characterized association between a sleep disorder and hypertension. What do I mean by obstructive sleep apnea? This is a condition fairly common, occurs definitely in between 2 to 4% of the adult population. There are estimates that it may be as common as 10 to 20%. That's 1 in 10 to 1 in 5 of the adult population. And this is characterized by repeated obstruction of the upper airway during sleep. And what it does is it drives up the blood pressure through multiple mechanisms. It makes the BP very difficult to control despite medication. So a very simple rule of thumb is when a person is on 3 medications at least, in proper doses, taking them appropriately, and still the BP is not under control, you should look for obstructive sleep apnea. And other clues, of course, are if the person, as I said, has a lot of sleepiness during the day because they don't have good quality sleep at night. If the spouse notices that they're snoring, if they have had, I've often had wives tell me, I thought he'd died, I thought he'd stopped breathing, and I had to shake him to wake him up. That's another very classic symptom. Putting on weight, especially if you think there's no good reason for you to put on weight and the person's putting on weight, that's another indication of sleep apnea. So we've got a small list of conditions that the doctor feels increases the chances that this person has sleep apnea. And one of the most important is high blood pressure, uncontrolled blood pressure, and using multiple medications and still not controlling blood pressure.
Yeah. My grandfather always used to say there are 3 most important things for anybody. Uma hai, in Kannada, that would be. So food, bowel movement, and sleep. So 2 things are definitely associated with, the hypertension. What you eat, how much you eat, and the calories or the salt that we eat, and definitely the sleep. The third one, I don't think I've found the association yet. I'm sure we will find the association soon. My next question would be to Dr. Srikanth, please. Srikanth, Dr. Murali Mohan alluded to resistant hypertension. He didn't say the word, but he alluded to that. My next question was going to be that, and it was for you. How would you classify, when would you say that somebody is resistant to treatment, and how would you manage these people? The reason I'm asking you this is many of our patients, when we start increasing the medicines to control their blood pressure, they're very worried. They're worried that they're taking too many medicines, and the question they ask is, sir, am I going to have side effects from these medicines? I'm taking too many medicines. Are you sure that I'm not going to have side effects from taking the medicines?
So, what we should understand is hypertension, as we age, the pressures keep increasing. And what was, as Dr. Murali Mohan just told, like with lifestyle changes, he could control for 1 year. That's normal, what we see. They are fine with some medication or with lifestyle alone, and over a period of time, that may not be sufficient. So we end up using 1 or more medications. If the blood pressures are very high, we start with multiple drugs at the beginning. And if the blood pressures, over a period of time, they may reach a stage where in spite of using 3 medications and in the full possible doses, which the patient is able to tolerate, and the blood pressures, as we already discussed, like in various subsets, the thresholds are different, how much we want to bring it down to. If it doesn't reach that level, then we call them as resistant hypertension. So in such patients, we may have to use more drugs, and then we may have to check why he is not responding. We shouldn't. The important thing about treatment of hypertension is the medicine will only work for a certain period of time. And as if we constantly use the medicine, the blood pressure, what was like, if I take the medicine today, if my blood pressures are higher, it may come down by a certain unit. Over a period of time, that will come even lower. So the medicine will take some time to act. If you skip the medicines, we don't get the response, and they have to stick to their lifestyle changes. If they all do it, the number of people not responding will come down, but it's definitely there will be a small proportion, and side effects will be there if we don't monitor. So that's important that you see your doctor and discuss with him, and then find out what are the possible side effects, and it can always be monitored. We know when we use certain medicine what the side effect could be, and if they are either verbally we can discuss, or if some test needs to be done, we can always do the test to find out if there are side effects. We should not worry about the number of tablets we are taking, it's important that we control the value and bring it to the value as close to possible as we have decided for you.
Yeah. Yeah. So you're saying, although the definition of medical definition of resistant hypertension only takes into account the number of medicines the person is on, but actually very important is that we also look at their compliance with diet, their compliance with exercise and weight loss, etc. Apart from their compliance with medicines as well. So many a times, if we get them to take the same number of medicines but then comply with the diet and exercise, we might be able to get a better control of blood pressure.
So they've also found out, like, if you you consider, okay, I'm using 3 drugs and the blood pressure is not controlled, and you closely monitor and tell them to be strict with their medications and follow the lifestyle changes, not take salt or whatever dietary advice has been given. And if you closely monitor them, only half of them will end up having the blood pressures above the target range. So that's the...
And as Dr. Mohan said, many of these people also have sleep disorders, which also need to be looked at to help them. And that's what we do when we see people in our outpatients. We are the last people to increase your medicines. We are the last people. We want to look at, how much you're exercising, how your diet is, and whether you could be having some undiagnosed sleep disturbance. We always look at other things rather than increase your blood pressure medicines. And if your doctor increases your blood pressure medicines, that is for your good. And these medicines have been tested. We will only give you these medicines only when we know that the benefits of these medicines are outweigh the risks involved. Nothing in this world has got is got only all benefits and no risks involved. Medicines are the same. Any medicine has got benefits and adverse effects or risks, and we have to convince ourselves before we give medicines to you that the benefits outweigh the risks. My next question would be to Dr. Murali Mohan. So we discussed about checking blood pressure to diagnose. There's no other way that we can diagnose hypertension because it is asymptomatic, and it is quite cumbersome to check blood pressure with these cuffs. The cuff monitors are the gold standard. The mercury manometer is getting outdated because of the toxic effects of mercury. But then the regular way is still to use a cuffed blood pressure monitor to check blood pressure. That is quite difficult to do. And if we have got non-cuffed monitors, like the ones which we are getting now in the electronic wristwatches or fit bands, etc., or even mobile phones, lots of electronic devices, if these are reliable, that can be used to check blood pressure of a wider population. But I always worry as to how reliable these are, and can we rely on these readings? What do you feel, sir?
So I think the ones that are validated are the arm cuff monitors. I think repeatedly, if you look at the guidelines that we get from the official bodies, they all insist that you should use the arm cuff monitor. Whether they're digital or otherwise doesn't really matter. And the digital ones are really easy for self-monitoring. So you can monitor at home with them. I think the others are unproven. And while the important thing is to get blood pressure monitored, I think it's also important to get it monitored accurately. And this is both for the sake of diagnosis and also to see whether you've reached your goal and whether you need to go back and get it retested. How is it at home, under ideal circumstances when you're relaxed, and how is it at other times? And all these are better done with officially accredited BP apparatus. And you actually have a list of these, what has been tested and tried. As you said, we are moving away. We can't get mercury apparatuses anymore. The aneroids are not easy to self-use, but the digital ones are extremely easy to use. And I think one should stick to the arm-cuff monitors. The wristwatches and so on are pretty good actually for heart rate and for
ECG as well nowadays.
Heart rate, and they pick up on ECG abnormalities, on rhythm disturbances, but I don't think they've ever really proven themselves for blood pressure monitoring. monitoring.
As an extension of the same question, how do you think we can tap into the penetrance of all these mobile phones or technology into even rural population? How do you think we can use that to increase the awareness, increase the diagnosis of blood pressure, and increase the compliance? So overall control of blood pressure. How do you think we can do that?
So one of the wonderful things about today is the penetration of mobile phones everywhere, including in the rural population. And I think it's got two aspects. One is the education aspect, and you use the mobile to reach out to people. We are seeing an example of that in a slightly irritating fashion with the coronavirus messages, but it also shows you that you can actually achieve what you want with a short, well-placed message. So the first thing would come in health education with respect to high blood pressure, perhaps with respect to get your BP checked, with respect to follow the right non-pharmacological treatments, which is food, be careful about salt, have you meditated today, have you taken your medicine today, that kind of message. And that could be tailored to specific groups and individuals in different parts of the country. There are some parts of the country where salt intake is very high, and there the focus could be more on salt. The other, of course, from diagnostic point of view, is to look for to use the BP apparatus to communicate with your doctors. And in the post-COVID area, we think we are going to be using electronic means of communication more and more. So that's one area where we will be focusing on, where you can communicate with the doctor and get your BP medication adjusted more frequently without actually needing to visit the hospital, and we hope that will happen. The other is, I think, looking for indirect effects of high blood pressure. I think Dr. Krishna Kishore and Dr. Srikanth referred to that. Look at the target organs and then see how you can monitor these with your BP, with your mobile phone.
Yeah, excellent. So my next two questions would be for Dr. Krishna Kishore. My next question to you, Dr. Kishore, would be pertaining to the coronavirus pandemic and the anxiety that many people who are taking antihypertensives have about use of one particular type of antihypertensive called the angiotensin receptor blocker or ACE enzyme inhibitor. So because the virus tends to use the angiotensin receptor to get into the cell, there were lots of what to call false information about the risks of using these two sets of medicines in control of blood pressure. Could you explain to us about it, please?
For all the doctors treating hypertension would know that two drugs which are indispensable is angiotensin converting enzyme inhibitors and angiotensin receptor blockers. These two drugs, I would say, indispensable because of their very beneficial effects on various organs in the body. So the anxiety that people have with respect to coronavirus pandemic is not unfounded, I would say, because the mechanism of this virus entering the body is through the ACE2 receptors. And when in people taking these drugs, which we call angiotensin converting enzyme inhibitors or angiotensin receptor blockers, these ACE2 levels are increased. So it is understood that there is more scope for the virus to enter into the person, into the body. But there are various studies done in various countries where the coronavirus is rampant, like in China, Italy, and United States of America. And the number of people that they have seen in the studies are in excess of 4,500, in excess of 3,000, in excess of 1,500. The observations were uniform in all these countries in the various studies that was done. Neither the risk of infection nor the severity of infection is found to be high in people taking these medicines. On the other hand, in one study done by China, where the number of study population is in excess of 1,100, they said that the severity of COVID-19 infection is rather less in people taking ACE inhibitors as compared to others. At this point in time, we can only say that these are only associations. We are not trying to prove anything, because as we know, as a pandemic, it is evolving every day. As we get more and more new information, we have to avoid the information. At the present stage, I would say that these people, those people who are taking ACE inhibitors or angiotensin receptor blockers are not at increased risk of increased severity of infection.
As an extension of the same, is it true that people who've got uncontrolled hypertension and also diabetes are at higher risk of having a more severe infection with the coronavirus?
Yes, a single line answer would be yes, because it depends on the number of comorbidities a person is having. So whether they're having diabetes, they're having hypertension, they're having kidney disease, or they're affected by cancer, all these are comorbidities which leads to more and more burden on the body in addition to this virus infection. So I would say yes, these people are at increased risk and they need to be very, very careful.
And the last question would be, are there any advances in treatment of high blood pressure? I know the last time I know of any advance was the direct renin inhibitor more than 10-15 years ago. There have been no new class of drugs which have come, but is there anything in the horizon at all?
Yeah. So as we know, hypertension, there's no magic pills to control hypertension. So as has been repeatedly emphasized by all of us here, it's one thing that is more important is the control of blood pressure. It doesn't matter whether you're using 1 drug, 2 drugs, 3 drugs or 5 drugs. And there is a certain population like people with kidney disease, especially on dialysis, who requires many drugs for the control of hypertension. I've seen people taking more than 8 drugs for the control of hypertension. In spite of all these things, the hypertension still remains uncontrolled. I would not say whether this is an advancement and this is another form of treatment to control blood pressure. I would say certain interventions like maybe renal nerve sympathectomy, so it might be helpful in people who have uncontrolled hypertension. The other part is in response to the pathogenesis. Most important question that I come across in the OPD is a person asking, why do I need 2 drugs when my neighbor is taking only 1 drug for the control of hypertension? So this is where it is like one size fits all. Does it fit all? No, definitely not. So now the medicine is advancing towards that stage where we are trying to find out what is the real cause of this blood pressure or hypertension. We are told that 90% of the people with hypertension have no cause. So that should not be true. So we need to find out what is the cause of hypertension in all this major population. So in that way, we are having more advances in science and technology, I would say, which is called the personalized medicine or precision medicine. So this says that each person is different. So we need to work out on that particular person to find out what is the cause and what is the treatment. So, for example, let's say in a family, a mother and father has hypertension. And what is the chance of the children getting it? It's about 30 to 50%, which means that this group of people are clearly at increased risk. So we study those people to find out what is the risk in terms of genetics. So do this RNAs and single nucleopeptides and all these things are advancements, I would say. This is more into genomic medicine. Yes, these are the advances that are happening and which we're going to see in the near future about detailing or about prescribing the medicine to a particular person rather than saying for everyone to take a single medicine or any type of medicine. I think this is what we're looking at.
Thank you very much, Dr. Kishore. I would like to thank all the 3 panel members for the excellent educative past almost an hour, I would have thought, of information on hypertension. I've made a few notes here to highlight to the audience here. There are about 10 or so. I'll just read them out. So most importantly, hypertension is asymptomatic. So don't keep waiting to have some symptoms before you go and get yourself checked out. I would say start getting yourself checked out as soon as you turn 18 and do it at least once a year, if not more often. Lifestyle changes are the foundation and the pillars of management of blood pressure. It's always lifestyle, which includes not smoking. If you're smoking already, stop smoking, lose weight, exercise, watch what you eat. So, in diet, as Dr. Srikanth said, you have to reduce the calories as well, reduce simple sugars as well, reduce the salt by almost 60 to 70%. Exercise at least 30 minutes every day. Prevent onset of hypertension. So if you do all these things even before you get hypertension, that's the best thing that could happen. But even if you've been diagnosed, do all these things. And then, as Dr. Mohan said, yoga, meditation, these are all definitely going to help. We are not so sure about alternative medicines, but if you're using them, check your blood pressure regularly. If it is under control, also check target organs, because sometimes it might not be visible. So you're just checking random blood pressure once in 3 months. It might not be very high at that point in time. There is a set of people who've got what we call as white coat hypertension. We didn't have time to discuss about all these things. And then there is a set of people who actually have better control when they come to the clinic, but then the blood pressure is high when they're at home. That is called masked hypertension. The percentage of people who've got white coat hypertension, that is, their blood pressure is okay at home, but then it's high when they come to the clinic, could be about 10 to 15%. But then the percentage of people who've got masked hypertension could be up to 30%. So there could be a good cohort of people who actually have higher blood pressure at home, but then normal blood pressure the moment they see the doctor. So checking blood pressure at home is very important. So keep checking blood pressure at home, no matter what you're taking. If it is not under control, for most people it would be less than 140/90. There are subsets where we want much lower blood pressure as well, but if it is not under 140/90, you have to go back to your doctor and get yourself checked out. There might be other things like sleep disorders, etc., that we have to look into. And high blood pressure affects most organs in the body. Your brain can cause stroke, heart attacks, heart failure. The blood vessels, it can cause enlargement of blood vessels. We call it as aneurysms, which can even rupture. It can cause kidney failure. So multiple organs are involved if blood pressure is not under control. And controlling blood pressure has been proven beyond doubt that it is going to slow down the progression of disease in these target organs. There have been lakhs together of patients tested with good blood pressure control and not so good blood pressure control, and the ones who've had good blood pressure control have fared far, far better than those who've not had blood pressure control. Once again, resistant hypertension, as I said, there could be other things. You have to go back to lifestyle changes, sleep disorders, all these things. We do not want to give more medicines to you, but sometimes we don't have a choice. We have to give you medicines, and more medicines does not mean side effects to you. We always weigh the risks and benefits for you. And in the corona era, we want your blood pressure to be controlled very well, because those who have got good blood pressure control will have less risk from the infection in terms of the severity of the infection than those who don't have controlled blood pressure. And all the blood pressure medicines are safe, including a class of blood pressure medicine called the angiotensin receptor blocker or angiotensin converting enzyme inhibitor. All of them are safe for you in this era of COVID infection. Thank you so much.